You know, when I was a kid, my grandmother always said how much she hated potato soup. I only learned years later that it wasn't the taste or the consistency. It was because during some really dark financial times, sometimes there was only enough money at the end of the month to buy an onion and a few potatoes and make a whole pot of soup to feed the family for a few days or maybe even a week. And here we are today, all over again. More and more people are running short of money well before the next paycheck, and scrambling to feed their family and make ends meet. People are cutting out or cutting back necessary household items just to be able to pay the basics like rent and utilities. One of the things that people frequently delay is taking care of their own health. And sadly, at the same time, people are giving up hope on having any kind of reasonable health insurance. But before you make yourself sick about it, there is no reason to allow a tight budget to compromise your health. I'll tell you how you can live on a tight budget and still take proper care of your health without leaving your pockets turned inside out. My name is Art Getz with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about health, healthcare, and health benefits that can make your life better. For most people with health insurance, you just keep paying the premiums over and over and never get anything for it. It pays for nothing when a big health crisis comes along until after you've paid a big fat deductible first. And even then, they only share the rest of the bills with you. So if you're on a tight budget, you'll be eating a lot more potatoes if you have to pay the health insurance deductible because someone in the family got sick. That's why health insurance is one of the first things on the chopping block for elimination. It's just not that great, and you feel pretty healthy. And not having health insurance certainly does not compete with an empty gas tank or a hungry family. Some people say having no health insurance is like going bare. In other words, being essentially naked and afraid that something unexpected might go wrong with your health, landing you on your own personal pile of potatoes. It's definitely not the reality TV show that you want to win. At the same time, when money gets tight, it's super easy to kick a few cans down the road. Things like routine, primary, and preventative care are really easy to sweep under the rug and just to avoid out-of-pocket costs that you just don't have the money for. Recently, one of my employees actually told me with some measure of pride that she's been raised in a family that believed whenever you got hurt or injured, her parents would just say, rub some dirt on it and you'll be fine. She said she always thought that that's just how it worked with doctors and healthcare. Honestly, this is such a horrible commentary on the state of affairs that young people are learning you got to choose between cheap dirt or routine healthcare. Whenever I talk to somebody on a tight budget, which happens a lot lately, I tell them you've got to stop letting health insurance companies drive the bus on your health. Over the last 50 years, these huge profit-hungry health insurance monsters have essentially taken control of healthcare for millions of Americans. It's gotten so bad that a recent survey showed more than 50% of people said that health insurance and healthcare were the same thing. They aren't. They aren't even close. One takes care of people's health while the other is making money off the sickness of others. Fortunately, there are better and cheaper alternatives to health insurance that a lot of people just don't even know about yet. That's really what motivated us to create the Health Benefits Network, to help inform people like you and educate you about the growing trends that are impacting people and businesses who are moving away from traditional health insurance. It's pretty troubling when you stop and think about how people have just blindly trusted health insurance companies for so long, especially because most people are such uber consumers and price-minded shoppers, but not when it comes to healthcare. Americans have been kept in the dark about the cost of healthcare and bamboozled into the false belief that health insurance is the only way to protect your family from financial disaster that comes with unexpected medical needs. Well, now is the time to pull back the curtain and expose the real truth about getting great health benefits on a tight budget. The first step to having great health benefits benefits is to step up and take back the steering wheel and drive your own healthcare choices. Everyone has very different circumstances and beliefs and financial means when it comes to personal health and finances. Nobody can decide what's best for you and your family but you. And to be sure, there is no one solution that's going to fit every individual or family. When you jump back into the driver's seat, you have to understand there are two types of healthcare needs to worry about. There's routine care, and then there's catastrophic care that only happens from time to time. Routine care is part of your everyday healthcare needs. You know, things like doctor visits, colds, flus, medication checks, and other primary healthcare needs that just pop up from time to time for everyone throughout the year. Since these are expected and anticipated expenses, it would make no sense at all to use insurance to pay for them. Instead, the new best way to pay for routine care is by signing up for what's called a direct primary care membership. It's a cool new membership model where you sign up and you get unlimited care for one low monthly membership fee. You can have a virtual visit with your doctor or an office visit anytime, whenever you need it, and as often as you need, and no cost beyond your membership. Even for most urgent care needs, you can just take out your cell phone, have a virtual consultation with your own doctor, and determine if you just need a prescription phoned in, or do you really need to go to the urgent care or maybe even the ER? Once you remove all the routine primary care from the equation using the membership, all that's left to worry about is any catastrophic healthcare needs that you may encounter. And the statistics say that these will hit most people about once every 7 to 10 years. Here again, of course, no one solution is going to be perfect for every individual person's circumstances and needs, but it is 100% true that if you are generally healthy like most of us, then health insurance is not the best fit for your budget or your needs. While health insurance may be the best alternative if you've got ongoing expensive healthcare needs, most healthy people prefer the lower cost of a medical cost-sharing membership to help pay for any large unexpected medical needs that arise. The real magic happens when you pair these two things together with direct primary care alongside a medical cost-sharing membership. Anyone can have the best of both worlds and still have grocery money left at the end of the month. You get unlimited access to your doctor anytime you need it. That doesn't cost you a dime out of pocket. You get freedom to choose any healthcare provider you want because the medical cost sharing community has no network restrictions like insurance does. And when the feathers hit the fan, and you know they will, you have unlimited access to all the higher level care that you choose, and the support and resources of a large community of like-minded people, all committed to sharing each other's medical expenses during that time of need. I hope you can see that there are some really fundamental differences between traditional health insurance and these innovative new alternative health benefits. Health insurance puts network restrictions on the doctors that you can see. Medical cost sharing doesn't. Health insurance is only responsible to their investors and shareholders who invest to make a profit, not a donation to a charity. Medical cost sharing communities operate as nonprofits with the sole purpose of paying members' medical bills. And best of all, one of these two choices is 50% less than the other. Can you guess which one? So the bottom line is this: if you want really great health benefits and you're on a tight budget, you're going to need to break a few old habits and embrace your inner customer, because health insurance just isn't cutting it anymore. It's 2022. Everything's changed, including healthcare and health benefits. If you'd like to know more about these innovative ideas for really great health benefits on a budget, just click on the link below for more information. We want to hear from you, so please leave your questions, thoughts, and comments in the section below. To make sure you enjoy more videos like this, please subscribe to our channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories like this. And don't forget to hit the like button. Share this video with your friends and colleagues. They have a health benefits problem too.